Hello, welcome to Procare Hospital's theatre. My name is Dr. Madri K. Stephanie. I'm a medical doctor at Procare Hospital. So today we'll be having a demonstration to enlighten the general public about the minimally invasive gynecological surgeries such as hysteroscopy and laparoscopy. But first, let me explain what hysteroscopy and laparoscopy is all about. Hysteroscopy is a minimally invasive procedure that allows the surgeon to directly visualize the uterine cavity without making any incision on the body. Laparoscopy is a minimally invasive procedure that allows the surgeon to directly visualize the abdominal cavity. Laparoscopy is also known as a keyhole surgery. So in laparoscopy, we make very tiny incisions about 0.5 cm on some parts of the abdomen. So this demonstration will be done by the Chief Medical Director, Consultant Obstetrics and Gynecologist, Fertility Specialist, and Minimally Invasive Gynecological Surgeon, Dr. Moses Fache.
Okay, thank you, Dr. Stephanie, for the kind introduction. This demonstration, we think, has become necessary because in the course of practice, we realize that a lot of women that we see do not quite understand what minimally invasive gynecological surgeries are. And so every time we have to, explain to them, it's like an imaginary thing to them. They don't seem to quite understand what it is. Even when you show them videos, most times what they are seeing is work is already being done inside the abdomen. So most of the time they don't quite get the access, and they keep asking, how did you put these instruments inside the tummy? So we decided to do this demonstration to actually explain how we gain access into the abdominal cavity or the uterine cavity. So we would start with the laparoscopy. And this is a phantom representing the patient's abdomen. So, usually we drape patients like this, and we just expose the parts that, we're going to be working. Now, the lines you see here are indicative of the traditional incisions. This is what we call the midline. If it ends below the umbilicus, we say it's subumbilical. And then if it goes above the umbilicus, we say it's supraumbilical. And so it can, jokingly, we say, okay, it extends from Cape to Cairo. And it's not very cosmetic. It leaves a lot. Most times there are ugly scars in the middle. It's prone to developing hernia, which is breaking down of part of the wound. And then, of course, the hospital stay is quite long, average of minimum of 5 days. Some people have to stay up to 7 days, 10 days in the hospital when they have surgeries using that incision. Of course, going further, trying to be more cosmetic, the low bikini line incision, as is commonly described, became, quite common, especially for cesarean and other pelvic surgeries that are just limited to the pelvis. We call the commonest among them is the phalansteal, which is usually the way it is. That's what this lower line is indicating. It's more cosmetic in terms of healing, and then, of course, it's not as prone to incisional hernia development compared to the midline incision. And then, of course, patients can leave the hospital usually on the 3rd day commonly. Now, the minimally invasive one, which is laparoscopy, what we're doing is creating tiny holes, just like you're seeing here. Because this is a dummy, the holes have already, but this is exactly what we do. This is what we do. And so you create a hole, and then you put, these are called cannula, trocar and cannula. So we introduce them through this hole, so we can pass our instruments through them. So that's it. And then you can have this one here. And so once this is achieved, we have already created, of course, we need to use, the normal abdomen is not this big. So this is showing that the abdomen has already been insufflated with gas. And so that's why it's like this. And so we couple our instrument. This is the laparoscope for laparoscopy. So we call it laparoscope. This is the camera head connected to the camera control unit there. And then this is the light source connected to the light, this is the light cable connected to the light source. So we connect the laparoscope and the light source to the camera head, and then light source on. And so we do what we call white balancing. White balancing is to create a white background so that the camera sees everything against a white background. So that is done. And so we introduce the laparoscope into the abdomen through the trocar around the umbilicus or above the umbilicus. And here it is. So you can see that we're seeing the uterus now inside this is the womb. And so this is the ovary and the tube on the right side. This is the ovary and tube on the left side. Of course, this ovary, part of it has been taken off, so you can appreciate how the inside of the ovary looks. Part of the tube on this side has also been taken off, so you can understand that there's actually a channel through the tube. This line here is just, an incision on the uterus. But this is how we are able to approach and access the uterus. So I will hand over the camera to Dr. Stephanie, who is my assistant usually. We do this in real life, and if you go onto our social media channels, YouTube, you'll find some of these videos. So once your assistant is focusing on the uterus, she is my eyes now, and so I introduce my instrument through this incision to gain access. So you can see my incision. I'm touching the uterus now, and so I'm here. If I need to tie this tube, I come in here, for instance, and then, hold the tube and then burn it. So we can work on the ovary, we can work on the tube, we can work on the uterus itself. We can remove fibroids from the uterus. We can do ovarian cyst using this approach. And the beauty is that because the incisions are so tight, are so tiny, hold it. The incisions are so tiny, when you remove this trocar after the procedure and deflate the abdomen, when you close this stitch, usually with one stitch, when you close this incision, when it heals, eventually it just looks as if it takes someone who really knows to know that you have had a surgical procedure. That is one. So it's very, in terms of cosmesis, it is best among all the incisions we have described. It also has the advantage that you can do this surgery, even major surgeries like removing the womb. We can remove this whole womb, where we talk about total laparoscopic hysterectomy, and the patient leaves the hospital the next day. That's the beauty. And so return to good health is quick, and patients can return to work faster than any of this procedure. And so even inside the abdomen, one of the concerns we have with patients who have had surgery is what we call adhesions, which is like gumming together of tissues that ordinarily are supposed to be sliding. So you see that the bladder is adhered to the uterus, the bowel from behind is adhered to the uterus, and that can cause a lot of post-operative morbidity. Some women may go on to have intestinal obstruction. That is very minimal with laparoscopy. So these are some of the advantages, apart from the cosmesis that you see outside. It allows quick discharge from hospital, and then there is minimal adhesion. So that is the beauty. So I think with this video, people would have a better grasp of what laparoscopy is about, and then how to gain access into the abdomen. And so now another thing is people usually say, oh, because they understand this as laser laser surgery, laser surgery. There is no way you can do surgery in the abdomen without going through an incision. And so what they are calling laser surgery is that when you introduce, once you're here, you can use different energy devices. The tower behind Dr. Stephanie has different energy devices. There are 3 energy devices. We have the ligature, and then we have the Ethicon harmonics. That's the Covidian ligature. And then we have the ConMed Beamer electrosurgical unit. So we actually have about 4 electrosurgical. So they produce different, the Ethicon harmonics, for instance, work using ultrasound waves. The ligature is an advanced bipolar system. So, and then of course, you can also introduce, you can do your surgery with laser. So when people say laser surgery, it's not like the laser is on the abdomen, because they just understand it like, laser surgery, there will be no incision. That's not what it means. You go in here and then you can use different energy devices to do what you want to do inside of the abdomen. So that is laparoscopy.
Thank you for joining our live demonstration at Procare Hospital. You can follow us on social media for more information. Thank you.